Hi, this is Dr. Daly from the Albany Medical College. I'm here to give a quick update on the Naloxone program for law enforcement. First, it's important to consider what we're using naloxone for. Naloxone, or Narcan, reverses the side effects of opioid drugs. And opioid drugs are drugs that are derived from or are similar to opium. There's morphine, heroin, OxyContin. Something we're hearing a lot about now is fentanyl and fentanyl analogs like sufentanil and carfentanil, methadone and Suboxone. And then there are drugs that you'll encounter every day like cocaine, amphetamines, and benzodiazepines like Valium and Xanax. And those are not opioids. If we recall how an overdose occurs, the opioid causes someone's breathing to slow. Ultimately, it can stop. When it does, the lack of oxygen will cause brain damage, cause the heart to stop, and that will lead to death. The goal will be to treat the patient when their breathing has slowed, they're unresponsive, but before their breathing stops, and certainly before their heart stops, so that they can live. Naloxone, or Narcan, is the drug we use to reverse opioid overdose. It's a very safe drug for us to use. It doesn't matter if you give it to somebody who has not used opioids. And it reverses the opioid overdose. It can be administered intravenously, by injection, or in law enforcement, we're choosing to use an intranasal route. It blocks opioids from acting on the body for about 30 to 90 minutes. I like the analogy that it knocks the ice cream out of the cone, if you think of the ice cream as being the opioid. But what it really does is it prevents opioids from working on the body. Because of that, people who have overdosed and have stopped breathing will start breathing again when we give them Narcan. Public Health Law 3309 is the community access naloxone law that allows law enforcement officers to carry and administer naloxone to victims of overdose. It protects that non-medical person from liability when they're using naloxone in the setting of suspected overdose. This is extremely important because it's the foundation of our law enforcement naloxone programs. On the left-hand side of this slide, you'll see a deputy from the Rensselaer County Sheriff's Office administering naloxone to a mannequin in one of our first naloxone trainings in 2014. Since that time, we've advanced. Currently, we use a single-step naloxone formulation. But the rules are the same. If an officer suspects an overdose and that patient is not responsive to painful stimuli, you evaluate their breathing status. If the patient's breathing normally or fast, turn them on their side. If the patient is breathing slowly, give them naloxone. And if the patient's not breathing at all or gasping, give them naloxone and administer CPR. The formulation of naloxone we're using now is actually called Narcan. This company purchased the rights to the name. It's 4 milligrams of Narcan, which is a lot of medication, in 0.1 milliliters of diluent. You hold it between your fingers, you stick it in the nose, and you push the plunger. Don't prime the device, because if you prime the device, you'll squirt all of the naloxone out the end before you put it in the nose. You should repeat in about 3 to 5 minutes if there's no effect from that initial dose. To reiterate, when do you use naloxone? When you suspect an overdose. First, do a sternal rub and make sure that person's not responsive to painful stimuli and that they don't start breathing when you cause that painful stimulus. Evaluate their breathing status. Are they breathing normal or fast? If so, turn them on their side and make sure that if they're going to drool or throw up, that it'll be able to drain. If they're breathing slowly, so less than 10 times a minute, then administer the naloxone. And if they're not breathing at all or they're gasping, give them naloxone and start CPR. So how's this program working? The simple answer is spectacularly. Since 2014, there have been almost 12,000 naloxone administrations by 6,600 unique law enforcement officers across New York State. These represent 647 agencies in 62 counties across the state. In a significant proportion of these cases, law enforcement arrived first. In some cases, greater than 20 minutes before EMS got there. In almost all these cases, administration of the medication was correct. And across all of these cases, with the old formulation of naloxone and the new formulation of naloxone, law enforcement is administering an average of about 2 doses of naloxone during the time they're caring for overdose patients. Law enforcement officers usually arrive first on the scene. In fact, more than 85% of the time they're there before EMS because law enforcement officers are on constant patrol. Therefore, they're in a perfect position to provide life-saving intervention for the citizens of the state of New York. Whether it's administering naloxone, using a tourniquet to stop severe bleeding, using a defibrillator, or just starting CPR, all of these interventions have the ability to save lives. Thank you to law enforcement for all of these. In these cases, if you think about it, when a patient doesn't get medical intervention for an overdose for more than 5 minutes, that's a long time not to breathe. That person has a really high possibility of dying without law enforcement's intervention. In most of these cases, officers are giving 1 or 2 doses of naloxone because naloxone is an incredibly efficient drug at reversing overdose. In some cases, they're administering more than that. I would caution to allow time to pass between the first dose of naloxone and a repeat dose of naloxone to make sure the drug has time to work. Really allow about 3 minutes between the first dose and the second dose of naloxone to assure that the drug has ample time to reverse the effects of the opioid. You'd think that COVID might have changed the response that law enforcement had to overdose, but they didn't. And most of the people that have been aided by officers have lived, which is fantastic. If you look on a monthly basis, there's a pretty steady amount of naloxone utilizations across the state, regardless of the spike in COVID cases that we saw in January of 2021 or March, April of 2020. Let's take a quick minute and talk about fentanyl. Fentanyl is the most powerful opioid that we use regularly in medicine, and it's been illegally manufactured since about 2013 and has been getting into our drug supply across the country since then. We're finding that it's mixed not only with heroin, but also with other drugs, including cocaine and methamphetamine, as well as in fake pills. So people are getting this incredibly strong opioid when they had no intention of doing a drug that was that strong or had those effects. While there have been reports of public safety personnel being put in harm's way because of exposure to fentanyl, the risks to public safety are really quite minimal. That said, use common sense. If there's an unknown powder, don't touch it unless you have appropriate personal protective equipment on. And if there's a location that appears to have aerosolized powder in it, don't enter, again, unless you have appropriate personal protective gear. To close, it's important to remember opioid overdose happens to people from all walks of life. An opioid overdose is a symptom of a disease, the disease of substance use disorder. And this isn't going away. Law enforcement has been an incredible partner in the treatment of opioid overdose and the care of citizens across New York State. Thank you for your professionalism. Thank you for your attention, and stay safe.